Hi guys, welcome to my YouTube channel, and today we are coming to you from the KICC grounds where I have just wrapped up the moderation stroke MC for the Nation Media Group Health Summit. As a health and science reporter, it's an exciting opportunity. So coming up on this video, I will be showing you what I was up to from day one and a little bit of day two. I got to meet my icons, guys, Eric Latif, Janet Mbugwa. I was like, I couldn't hold myself, and you're like, guys, you relax, these are your colleagues, but I couldn't. So please, let's watch this video. Remember to like and subscribe, and let me know what you'd like to see in this channel. So hi guys, welcome to the Nation Media Group Health Summit going down here at the KICC in Nairobi, and it's a day where you can walk in, get your medical checkup, get screened for cancer, for HIV, for STIs, but most importantly, we have the team on the ground. Emergency response is quite important in any medical case, and I'm going to speak with some of the guys here who are part of this summit. Welcome. Just let people know who you are and what you do.
Hi, my name is Purity. I'm part of the AR medical group and I'm a paramedic by profession.
So what is a paramedic for guys watu hawajui ni nini unafanyanga? Unafanya nini?
So a paramedic is a first responder on the ground. The person you call first when you have an emergency, I'm the one you call. So when you have diabetes, anything, basically any medical emergency, we handle you, we stabilize you before we get you to the hospital.
What would you like young people to know about healthcare that they don't know and it's quite important?
Healthcare is a responsibility to everyone. Just because you've not done medicine, it doesn't mean that you cannot be responsible for your own health. The more you get knowledge, the more you can assist even your neighbor.
So you have a teammate here. Hi.
Hi.
I saw you're on the driver's seat. Fun fact, ambulances, do they cheat traffic?
Not exactly. You do what you can and the minimal time you can to reach the patient. Yes.
So tell us why it's important for you guys to just be part of this summit.
Because there can be an emergency. You might never know, someone can get injured. So we are there to cover for that.
So thank you. You didn't tell me your name.
My name is Paul.
Okay.
Paul Ocheng from the AR team.
Okay, so that's Paul and Emma. Purity. Oh my God, guys. Purity from AAR team. They are going to be in charge of any emergencies around here. But guys, if you're in Nairobi, within the CBD, make sure you're here at the KICC, because this is a place where you know like your health checkup is going to be done. And remember, in health matters, prevention is better than cure. One of the concerns for the Ministry of Health is the rising HIV infections among young people, and this is a key population that has been identified to be progressively advancing the triple threat, and that is HIV infections, GBV, and also teenage or early pregnancies. But here at the Nation Media Group Health Summit, that is also being addressed. We have a free medical camp and people are getting tested. I'm just going to be joined on set by, say your name.
My name is Harriet Duke.
Harriet, I've seen you here utilizing the free services at the Nation Media Group Health Summit. Tell us why it's important for a young person to really take care about their health.
I think it's important to get tested so that you know your status, and this will help you protect yourself and also protect others. Yeah,
so young people kuna issue ya sex, talking about sex is a taboo, but what would you want the older generation to know about talking about sex to the younger generation?
I think sex should not be a taboo, because we know a lot of people are having sex. So I think our parents should be free to talk to us about going for testing, because also for me, my parents never talked to me about HIV or anything or about pregnancy. But I think it's very important, and I feel like us as the Gen Zs, we are very open about talking about HIV and STIs and STDs. So I would urge every young person to at least get tested.
How often do you test for HIV?
It's my first time.
Oh wow, you're nervous?
A bit.
Oh, okay, so you've said that you didn't know about sex from your parents. When did you learn about?
I think it's just the basic knowledge that you find yourself umejua tu, and also from online. Yes.
There's always that tension that you go through before an exam, and also there's the tension when you go through your first HIV test. I remember I was a ball of nerves, and so come. Tell us your name and why you decided today, during the Nation Media Group Health Summit at KICC, you said, I will go and get my free HIV test.
My name is Patricia Morange. I am a journalism student. I'm so nervous. I think it's just for preventive care, and it's easier if you know. So if you know,
If you know, you know.
Yes.
If you know, you know. And how did you learn about sex? I've just had a conversation with your friend. Like, what would you want the older generation to know about conversing about sex with the Gen Zs?
I think it's a topic we should be more comfortable talking about because people act as if you ignore it, it's not there. I think we should talk about it and make it a conversation everyone is comfortable to have, not something people are shunned when they talk about, not something people talk about in secret because you can't find people talking about sex in openly.
Yeah.
And if they are, they're considered perverts.
Where did you learn about it? Oh, yeah, pervert. Yeah, where did you learn about sex?
I think online and everything we were taught ilikuwa class 4 reproductive system. That's the end of sex. That's I know. But then when you grow up, you start learning and collecting things from everyone, everything you're hearing from people and people's experiences.
What's the danger? What is it that you learned about sex online that in reality is not the truth?
I don't think I can tell you that. No, I don't have any.
No, like there's this perception and then in reality it's not the truth. Like misinformation, disinformation about HIV transmission. What is it that the internet said that is not the reality?
Don't have any.
You don't have anything. So it's okay, don't worry. All the best. And yeah, encourage other people to come and get themselves tested. You're from which university?
KCA. Please come to KSCC. There is a free medical camp. You can get tested for anything and everything, for early diagnosis and everything else, and for preventive care.
Yes, thank you so much. Thank you so much. So guys, we are here at the Nation Media Group Health Summit at KICC. Come one, come all. Leo ni Leo. If you know, you know. One of the things about UHC is making the difficult aspects of getting screened and testing quite easy. And right now, I just want to walk into the National Cancer Institute's booth to get my checkup free for cervical cancer. Come along. Ninatetemeka, Mungu. Nisaidie. Doc, tell us what you're going to do for me now.
So thank you so much. Right now, you've just walked in. You are going to, I'm going to give you this cotton swab.
Okay.
And we are going to show you how to collect the sample. Okay. So you're going to enter into this private seclusion here. And within 2 minutes, you'll be able to collect the sample for us to run the test.
So there's no me lying down. Remember, previously I've gotten my screening for cervical cancer and it's usually uncomfortable. So with this, and then in 2 minutes, I think I'll be ready.
It's 2 minutes, just 2 minutes.
Okay.
The first time, because you just need to insert and rotate 10 to 15 times. And it's pain-free. It's simple to use. You won't experience the longer methods where women have to lie at the back.
Invasive, yeah.
Yeah, kind of like the longer method, which women actually don't like it.
Okay.
So the cotton swab here is simple to use, and you won't experience any sort of pain or any discomfort.
Okay.
It's
so I'll let
fast
you
and
know.
simple to use.
I'll let you know how the experience is. Once I go behind the curtains, you won't see me, but I will emerge with my sample in hand.
Yeah.
Okay, thank you. So I've just done my sample collection. My experience was like the way you'd be cleaning your ear, but now, like you've squatted. Now this is my sample and they tell me that in 15 minutes I'll be able to know the results. I'm nervous. So cervical cancer is a cancer that affects women's reproductive system, actually the cervix, and testing has been ongoing here at the National Cancer Institute exhibition site. So you've taken your test. Just tell people your name and why you decided to drop in for a free cancer test.
Okay, my name is Rachel Safo. I decided to come and do the test because of my experience with cancer from my family. So when I saw this ban, I decided just to go for it. And the main reason is because of what I have experienced from my family, setup. I have lost a number of family through cancer. And then come to cervical cancer, I lost my grandmother with the cancer. And also there is one of my auntie who also died out of the same type of cancer. Yeah.
Is it the first time you're getting screened or you've been getting screened?
No, this is my first time. I was really scared, but I was surprised that the process was not. I thought it was going to be a bit, a bit uncomfortable, but it was just a simple process.
Yeah.
Yes.
So how long are you going to wait for the results, and maybe why would you want women to come in and just get tested?
Okay, they assured me that I was going to get my results after 15 minutes, and I'm waiting for the results after the 15 minutes. Yes.
For anyone who has never had a screening for cancer, like cervical cancer, just send them a shout out. The Nation Media Group Health Summit is here at KICC. Let them come, let them get screened.
Okay, in fact, I'm really concerned about my mom, and it's so unfortunate that she's not around Nairobi. I wish she could be around here. I asked the person who encouraged me to do the test, and he told me that if a woman has given birth to many children, and let's say that he started giving birth at a very tender age, he's prompt to this type of cancer. So when I look back, looking at my mom, I think she falls under that group. So I'm a bit concerned, but I hope I'll get a chance to help her do the
I
screening.
think she can go to the public hospital
Yes.
where she is, because this is a national campaign. This is a government entity, by the way, the National Cancer Institute, and it's under the Ministry of Health. But I do know they have a network with the Mashinani health facilities, so you could encourage her to go to the nearest one.
Yeah, I think I will do so. And also to encourage other women, it's I know people fear. Like for me, I was a bit hesitant to do it, but I said it's better to know rather than, assuming, and then I come and find myself having it at a very late, stage. So what I'm trying to say is that I'm encouraging other women not to fear. The process is very simple, and it's good to know your status earlier than to come and get to learn about it at a very bad stage. Yeah.
Thank you.
You're welcome.
So siku ya kiyama yangu, or the day of reckoning, ndio hiyo. 15 minutes after I took my cervical swab, I'm able to know my results, and so I'm being joined by the lab tech. But the things here are just light. He doesn't even have paraphernalias for a lab. He just has minute things that are very effective. Tell people how fast it is to get a cervical cancer result from here.
Yeah, so it's very easy. My name is James Mwangi from Mobilab. I'm the program manager. So it's very easy. Once you take your swab, you come for the results after 15 minutes.
So I'm BN. My sample number was BN.
Oh, your sample number was BN. So like BN.
So how do you, once you get the swab, maybe show us what you do?
So once you get the swab, we have the buffers.
Look to the camera.
Oh, you have the buffers here.
Yeah.
So we insert the swab in this buffer. So here, and then we stir, and then we put it back. So here we have the swab. So you get this is the swab.
Yes.
So you open, and then you go and take the sample.
Yes.
It's self-sampling.
Yes.
So you rotate it 10 times. So once you rotate, the woman puts it back here.
Yes.
And then once she returns the sample, we have to label, very important.
Yes.
And then you have your card, and then we return it we put in the buffer, and then we close it.
Let me just show people what's inside the buffer. It's a form of a liquid. It's kind of liquidish.
Yeah,
You can come closer.
Yeah, so it's a liquid.
So that's where the sample is inserted.
Yeah, it's inserted, and then you close it. So these are examples of samples
Yeah.
which have already been, the swab has already been inserted and then taken out. So this one, we put it on, you leave it to stand for 2 minutes. So once the 2 minutes is over, we have a cassette here.
Show us.
So this cassette, So after 2 minutes, we put
The contents.
yeah, because this the buffer, once you close, it becomes a dropper. So you put it, you put 4 drops in this cassette. Don't show the name. Put 4 drops, and then now we wait for 15 minutes.
So how will the results show? One line, 2 lines,
Yeah,
it's like
so
HIV?
yeah, it's like HIV. Two lines is positive, 1 line is negative.
Okay.
Yes.
Thank you so much.
Yeah. So and then you just come. So for you.
For me,
Only for you.
terrain. But it's not my first time to do a cervical cancer screening. What I've loved about this experience is that it was pain-free. You know, it's like, how can I, like for example, when you're removing wax from your ears, like something similar to that. So there's no discomfort, and also there's not that invasion of privacy. So guys, head on here to the KICC for the Nation Media Group Health Summit. These are my results. And
Yeah. So your results are negative. Yeah.
okay, thank you.
So you can. So yeah, results.
Okay.
So for reading the results, we use the UV light detector.
Okay.
Because this one uses what is called a full immunoassay. So it has high specificity and sensitivity. It's a technique. Because now it tags the antigen, and then now you're able to read it via the light. So for example, I put the light on, as you can see, and once I put the results there, you can see it's 1 line, very clear.
Oh, okay. So you don't need to like put a reactor on the cassette.
So we just put the drops.
Okay.
We put the
they already
drops.
have the reactor inside.
Yeah, the reactor.
So the reactor reacts to UV light. It's sensitive to UV
Yeah. So we had put 4 drops.
Okay.
And then now it's sensitive to UV light.
Well, wait.
So you can see the
Technology.
results negative.
Yes.
Very clear, as you can see.
Thank you.
Yeah.
Thank you so much, guys. That has been my experience here at the National Cancer Institute's exhibition site at the Nation Media Group Health Summit. Come over here to get your cervical cancer screening because it is one of the leading causes of death among women of reproductive age, and this is a cancer that can be treated if detected early. So guys, kilisho na mwanzo hakikosi kuwa na mwisho. So I am leaving Nairobi enriched. I am leaving Nairobi looking forward to a lot of content generation, especially in my beat, which is health and science reporting. So tukutane kwa hizi streets the internet, and thank you so much. Remember to like and subscribe and follow me on all my social media platforms.